Rich Castellano, and we're here with Myrna today. Thank you so much, Myrna. There we go. Now we're just starting on YouTube as well. Hello, everyone. Dr. Rich Castellano here, double board certified facial, plastic, and reconstructive surgeon. Yep. And we are doing a facial filler injection for Myrna. Myrna, can we tell them how young you are, dear?
I'm 77.
77. Doesn't she look great? She looks amazing. And so we're going to do one syringe of the Bellafill today. So have a look in the mirror. These are the areas she wanted to talk about, the little hollows we see here, right here. And so I'm going to use half a syringe on each side. She has had collagen before, so she is, her body does not react to it. We've also done collagen skin tests. So have a look in the mirror for me. So these are the areas that we're going to fill in right in there, okay?
Okay.
All right, and we talked about things as well, and she's very active, and so we're very proud of Myrna. Now, when I do the treatment, I use a numbing medicine, which is the lidocaine. The lidocaine is like at the dentist's office. You feel a little bit of a pinch, and we took her photos before, so we've got her before pictures. Nina, can you come by, or is Charlene available that you guys can help? And so what I do is I do a cleanse on the skin. Now, this is something we call HIBA cleanse. So this is the HIBA cleanse. There's this little orange soap here that orange, pink, salmon color. And we do a little cleanse here. There's a little bit of ice for you. So why don't you go ahead and put that ice on your cheek. So I do the cleanse, we do a little of the ice, we'll do it. Yep, go ahead, that's perfect, just like that. And then the ice helps the blood vessels to shrink a little bit. It also numbs the skin just a bit. And so I also use these little buzzer devices as the distraction. The brain can only focus on so many things at one time.
I have cheek implants.
No problem at all. And so what I'm going to do is I'm going to have you rest your head all the way back, and you can let this side down on the ice. So then I take the buzzer and you just put it on the skin, and you feel a little pinch on 3 here. 1, 2, 3, little pinch. Now, was that big, little, or medium pinch there?
A little.
Little? Okay, go ahead and put the ice up on that side, and same on the other. So we just do one little pinch on that side so you feel buzzed, and then pinch on 3. 1, 2, 3, pinch. Was that small, medium, or big pinch there?
Small.
Small, okay. Go ahead and put the ice on, so we keep it that simple. So that's the numbing medicine, and then, can you throw me some of that? Thanks. And so she's using the ice, so I like to do, that's perfect. Thank you so much. I'm going to do just a tiny, that's good. I'm going to do a tiny bit more of the cleanse. So go ahead and let the ice down on this side. So I'll do the cleanse right in through here, because that's the spot where I can see where we did a little bit of the numbing medicine right through there. And that's perfect. Now, what I do, I use a safety cannula here. So then I use a little 27 gauge needle, which is super small, right? Super small. And then, now, let me ask you a question, Myrna. Do you feel a little bit of a pinch? Do you feel a little pinch or not really?
I don't feel anything.
Okay, so she's numbed from what we did. So now that I made an insertion point through the skin, I can put the cannula through there. And this is the Bellafill. I like to mix a little extra lidocaine in there. So this is the syringe here, so you can see the syringe, and that's the Bellafill, okay? And then hello Chrissy, thanks for joining in. So I find that little spot, it's like a needle in the haystack, so to speak, and then I thread the cannula through, so you feel a little pressure, and then I use my finger here. Myrna, what do you feel, a little pinch there?
I don't feel anything.
Okay. So then I use this shiver technique. I shiver my hand around because it allows me to put very small amounts of the filler right through that part of the cheek where it's a little hollow. So I'll put a little bit here, a little bit there. You just want to spread, and as you can see, Nina, can you go and zoom in on that? And we'll get a little bit closer with the camera there, and I can feel the end of the cannula. That's good. Just zoom in a little bit closer. Yeah. Myrna, you doing okay, dear?
I'm doing fine, thank you.
So I thread the cannula through. So I do the twist technique when I twist through like this, and then a little shiver. And this way, you're just putting very fine amounts, and it's very comfortable for the patient. She may feel a little pinch or not. Now, we're not going to make it perfect, but we want to make it better. Because if it's perfect, if it's too good, it looks unnatural or fake. You just want to evenly improve the volume everywhere that you go. And some people call this the tear trough. So you can see that's where my cannula is, right in through there. Okay? And so now I do that little shiver technique. And the shiver technique is good to just spread fine amounts everywhere. Or if you actually do have a tremor, then you just tell them it's a shiver technique that you're using. And so We do a lot of trainings for doctors all across the country on our technique. We're very proud to be the #1 Bellafill injector in the United States. You can use it. It's FDA approved for use in the nasolabial folds and for acne scarring, and I use it as an off-label approach throughout the entire face. Myrna, how are you doing, dear?
I'm doing fine, thank you.
Good. So, now go ahead and take your ice down, dear, and open up your eyes for me. Can I get the mirror, please? So, now, just after doing that one side, can you see how the filler brings out that one side? Can you see the difference?
Oh, yes.
How does that look?
Isn't that amazing?
Yeah, so she's got a little bit of swelling. Even if I didn't inject anything at all, she'd have a little bit of swelling. I like to do a 5-minute massage 5 times a day for 5 days. So we filled a little bit of the valley, but we're going to go ahead and do both sides. All right, we're going to do the other side now. And I'm going to do a little bit more cleanse. So go ahead and put the ice on this side over here for me, on the right side, and then let this side down. I'm going to do a little more cleanse. We're going to do the other side. So thank you, Myrna, for being such a great patient. We haven't had to give her any warnings or anything like that. I'm just kidding. We don't give warnings. We're just joking around. So there I can see where I did a little bit of the numbing. So then I take the, that's fine, thank you. So then I take the little 27, if you're just now watching, you can see the 27 gauge needle. Someone said, how does it work for acne scarring? Hi, Jack. It works for acne scarring if you have an acne scar. Now, do you feel a little pinch here?
No.
Okay, so that's the insertion point where I will put in the cannula. The acne scarring, you actually have to get a needle in between the acne scar, in between the dermis and the epidermis, and you separate that. And then you inject the filler right in between the layers to fill out that valley in the acne scar. So now I find that needle in the haystack, that little pore that I made, and it threads right through. So you might feel a little pinch or not. Pressure pinch, pressure pinch. And then I use that little shiver technique here, and I can feel where my cannula is, and I can see it with my eye, and I'm right close by to the orbital rim is what we call it. That's the bony rim, and maybe a little harder to see it on the camera, but you can see the angle of my syringe right through here, and then I just do a little shiver technique to just put small amounts through these areas. Very small amount, just a little bit. And then as I thread through, I can see the direction of the cannula. And this is right on top of the bone. And just a little bit of shiver technique, just very small amounts. So I'll do that some left. Sometimes it's easier to do right-handed, and I do both sides. Myrna, how are you feeling?
I feel fine, thank you.
So the Bellafill is 80% collagen, 20% PMMA. And we're very proud of our patients. They look natural. They don't want to look overdone. And it's always better to come back another day and do more rather than go too far. Hello, Raquel. Thanks for tuning in. Please do share and let others know that you are watching long-term filler injections, live procedures. There's no filtering. There's no editing. You just see what you see is what you get. Do you ladies have any questions about what we're doing? We had a nice event here, and very proud of Myrna.
Doctor, will she have any bruising?
Yeah,
She might have a bruise. I don't see that much. From something like this, it's unlikely that she would have a bruise just from this.
Okay.
She will pass the grocery store test today. If she walks into the grocery, no one will really do a double take. So she'll have a little bit of swelling, but even if I injected her with nothing, and I just put the cannula in, she would, I'm gonna have you switch ice and put the ice on this side and let it down. Even if I just put the cannula in, she'll have some swelling from that. And then rest your head all the way back for me, dear. That's perfect. Everything's...
Once it goes down, it'll be...
Yeah, once the swelling goes down, she'll see her final results. So normally, I bring people back at about a month.
Mm-hmm.
And in a month, we'll take some pictures. Thank you for the comments. Okay, can I see the mirror, please? So, why don't you take a look in the mirror?
Different.
Yep. So she looks natural. Make a big smile, make a big smile, and then smile into the camera so they can see. See how good she looks. So there's a comment. My daughter, how long does the Bellafill last? My daughter has bad acne scarring. So the Bellafill is non-absorbable. It does stay with you, but aging keeps happening for us. So if you have questions, you can reach us at imagelift.com. So please let's give Myrna a big hand. Congratulations. We're very proud of you. You did so well.
Thank you.
Wasn't too bad, was it?
No, it wasn't bad at all.
Very good. All right, thank you for sharing on the video, and we're going to get started with the rest of the event. So, yep. Okay, very good.
Myrna, you did good.
I think she was a
Thank you all for tuning in. Do you think she was a plant? Well, this is the first time we met, right?
I've
Yeah,
never
no,
met you
she's
before.
There we go.
gorgeous.